Now, for question round 2, this is our first question from a member of the National Union of Healthcare Workers. It comes from Ken Rogers. He's a psychologist in Sacramento. He's practicing right now at Kaiser Permanente. And the question is going to be answered first by Delane Easton. It goes like this. Despite mental health parity laws, many patients still do not receive the same access to mental health care as they do for physical health care. Regulators have not enforced the laws aggressively for enough. For years, many patients at his clinic, he says, have had to wait 2 months for a therapy session. He says things have improved since the new union contract increased staffing, but he says that throughout the state, access remains an issue. Question, what would you do as governor to make sure that health insurance companies comply with mental health parity laws and that state regulators hold them accountable? I'm glad the question came up because virtually all of you in your opening statements hit this issue of mental health parity. But Delane Easton, the floor is yours for a minute.
Well, thank you. I will tell you honestly, as a superintendent of public instruction for the state, I spend a lot of time looking into foster care, into children with ACEs. The reality is that we have a lot of children who have tough childhoods, and they grow into adults who have tough mental health issues. And this is as vital as antibiotics, is to be able to get mental health care. The opioid crisis is a mental health crisis, not a drug crisis. The truth is that right now in California, we need to be on fire to improve the mental health of the people who live here. We've got more people living on the streets than I have ever seen in my life. And you can see that many of them are people that have to have mental health support. And if we do a better job, Switzerland, tried cracking down on opioids and cracking down on on the problems with drug addiction, and they had a huge problem. It wasn't getting better, and then they decided to switch what they did, and they focused on mental health, and now they have zero opioid problem. And I think we can do that in California.
The question now goes to Gavin Newsom. I'll repeat the actual question when it's phrased as a question. What would you do as governor to make sure health insurance companies comply with mental health parity laws and that state regulators hold them accountable?
Well, first of all, we need a statewide plan. California lacks a statewide plan for mental health. By one estimate, only 24 counties out of the 58 in the state have comprehensive services for behavioral health. So the issue of parity, it goes much deeper and broader than just holding accountable the insurance companies, which absolutely must be done. But we need a bottom-up, not just top-down approach to dealing with the issues of brain health. And brain health needs to be put on par with physical health. We need to get serious about treating early so we're not punishing later. I know we all talk about this, and it's not something that's an applause line or it's even something to respond to. It's tragic that the largest mental health facility in the state of California is the LA County Jail. You got 10 times more people nationwide in jail and prisons than you do getting culturally competent, community-based mental health services. I have a little bit of experience with this, doing wellness centers in San Francisco public schools to deal with adolescent mental health. And I'm very proud, and Prop 64, which I helped author, provides hundreds of millions of dollars of additional money for behavioral health services in the state of California.
The question now moves to Antonio Villagrosa. Would you like me to repeat the question, or?
Yes.
The question is, what would you do as governor to make sure that health insurance companies comply with mental health parity laws and that state regulators hold them accountable?
Well, first of all, I want to thank this union for playing a role. The ACA gave us mental health parity, but it was this union that gave it teeth in terms of timelines for urgent care and non-urgent care. We know that some employers, Kaiser particularly, has been fined millions of dollars because they didn't comply. I think the governor needs to work with the attorney general to make sure that they do comply. We got to fix whatever loopholes exist that allows them not to provide that care. And as governor, I will focus on that. I recognize how important the issue of mental health is. On the streets of Los Angeles, we have the largest homeless population in the United States of America. When you talk to those people, as I have many times, so many of them need that urgent mental health care now. And as governor, I'm going to provide it.
Thank you. John Chung, I can again repeat the question, or are you good to go?
I'm good to go.
Okay.
As your former state controller, I was the most successful auditor in California history, having identified $9.5 billion in abuse, waste, and fraud. That's because I hold the people that we contract with to accountability and accessibility and transparency standards. I would do that for the state with the state contracts, right? We need pay-for-performance measures with our healthcare providers. We need to make sure that we do more in regards to value-based medicine. We know that those who are trying to profit from the system and not following the rules, not providing the much-needed care that's critical to make sure that we improve the well-being of all Californians needs to be one of our great priorities in regards to the healthcare field. So I would aggressively push. Right, we would identify and make it transparent who is actually performing what services. Are they performing it in an effective manner? Is the state of California paying for it in a timely model and a cost-effective model? And so that we can drive further competition to make sure that we get the best outcomes and performances that we pay with our hard-earned taxpayer dollars.
Thank you. We have 4 minutes for discussion on this. Now, I'm just wondering, does anybody on the panel have a question to throw into the mix on this one? And if not, I, again, do. No? Okay. I'm interested in what, obviously, since you would need to be working with healthcare companies, you've all done a very good job of describing the problem, and in my view, a rather broad promise that something needs to be done, and I'll do that something without specifics at this point. And it's understandable because it's a difficult challenge. But what would be the pitch that you would make to healthcare companies that addressing mental health parity might actually be in their interests, or is it just an impossible job? Whoever would like to take that first can raise his hand or her hand and go first.
I can.
Antonio, sure.
I walked a picket line not so long ago on behalf of hospital workers that were victimized by people with mental health issues, beaten up, and management did absolutely nothing to address their safety. I believe that it's in their interest. Lawsuits will certainly develop as a result of people being beaten to a pulp by people with those mental health issues. So I think it's in their enlightened self-interest to do that.
And let me amplify. I think it's important to talk about new resources. Quite literally, in Proposition 64, we had the counties of LA and San Francisco help draft that section of the initiative that sets aside hundreds of millions of dollars, billions of dollars over the next few decades in new behavioral health and substance abuse dollars, new additional resources. At the end of the day, accountability is absolutely important. But we need more resources. We need more clinicians on the ground. We need more community-based services. And that requires not only resourcefulness as it relates to leadership, but additional resources. And it's an important note to set aside those dollars specifically on a county-based approach to deliver them quality care.
But is there, as your opponents are saying, there's a self-interest argument to be made to the healthcare companies. What is the self-interest argument?
Yeah, no, certainly from a litigation perspective, and there's a moral and ethical argument in addition to an economic argument, absolutely. And there's another argument that single payer would substantially address these issues in a broader perspective. But as it relates to the episodic relationship we currently have with the system, again, it's about emergency rooms, it's about jail, it's not about crisis management, it's not about treatment. We've got to obviously shift that paradigm more fundamentally. And again, end of the day, this issue of parity, the issue of access, is a bottom-up, county-by-county, community-based solution. And that's the approach we have to bring in terms of ultimately solving this crisis that is becoming more and more acute and fortunately more and more topical in this country.
Would you repeat your question?
My question is, what would, the fact is you're going to have to deal with healthcare companies, do you have an appeal to them that mental health parity is actually in their self-interest? Is there an argument to be made to them?
Well, the University of Massachusetts at Amherst suggests that we could save money if we cut administrative overhead and some of the waste that's occurring right now by streamlining delivery. Remember, we're dragging out the time it takes for people to get care. People have very specific, immediate, urgent needs. And so I would argue that the state of California needs to have the same sense of urgency about the care of our citizenry that the
why should a
have.
healthcare company listen to that argument? Other than the moral issue, why should they be persuaded by that?
Well, I mean, I think we ought to make it painful for them if they aren't more responsive.
Okay.
They're making money.
All right.
Thank you.
John Chung.
I think it depends on who's providing the care and the type of practice. We know that today under President Trump, we have community clinics that are struggling to keep their doors open. 1 in every 7 Californians today goes to a community clinic, principally women, people of color, low-income individuals. They care very much about mental health services because they understand that they have to treat the individual holistically. And so when you have people that are setting the standards, setting the bar as to how healthcare ought to be delivered, right, you can put the moral compunction, you can drive good economic actors, you can drive social activity, social impact, financing to change behavior in the larger market.
Thank you. And that concludes our second round of questions. Now we're going to go back to our journalist panel, and round 3 is going to be led by Bob Butler of KCBS. And Bob, the floor is yours.
Thank you.